Thanks again for taking the time to attend this press briefing on Haiti. The cholera epidemic in Haiti continues to spread and produce more cases. Today, the Ministry of Health Haiti, with support from PAHO and the Centers for Disease Control and other partners, is now reporting 3,015 cases of cholera and 253 deaths. I would like to emphasize that you may hear other case counts depending on the sources of information, but what I'm reporting today is the most recent information that we've received from the Ministry of Health Haiti, again being supported by PAHO and the CDC. Testing is being done on specimens from various parts of the country, from the northern province called Nord Province and from the southernmost province, Sud. In addition, we have 5 cases confirmed in the West Province, where the capital city, Port-au-Prince, happens to be located. I should emphasize that we expect these numbers to continue to increase and be reported from new areas of the emergence of infection. The data is a result of intensive efforts to build capacity in Haiti for surveillance of infectious diseases. And this was an early warning system that was established by the Ministry of Health with support from partners as a consequence of all our response to the earthquake on January 12th of this year. And currently, the Ministry of Health is building on these efforts to further strengthen their surveillance and reporting of cholera cases. The official numbers almost certainly underrepresent the true number of cases, largely because, in general, approximately 75% of the cases have no symptoms. They're asymptomatic. Yet they can carry the bacterium and transmit it to others. And in fact, these same asymptomatic cases may carry the bacteria up for 2 weeks and shed that bacteria back into the environment, especially where good sanitation facilities are lacking and potentially infecting other community members. Of the 4 in 1 infected people who develop symptoms, about 80% have only mild or moderate symptoms. In the absence of treatment, about 20% develop acute watery diarrhea with severe dehydration, putting them at risk for death. People with low immunity, such as malnourished children or people infected with HIV virus, are at greatest risk for death if infected. Because most people have less serious symptoms, effective treatment can be given outside the hospitals and health facilities. For most, it involves the administration of oral rehydration salts to replace lost fluids. These oral rehydration salts have been a public health intervention for years. They cost pennies, and they've saved millions and millions of lives, especially young children. Severe cases require intravenous fluids to replace their lost fluids through diarrhea and vomiting, and they may also need antibiotics. We learned yesterday from our colleagues at the CDC that the susceptibility testing of this bacteria is actually quite good. It's sensitive to the tetracycline antibiotics that are cheap, readily available, and can be administered appropriately. Now, just to give some background, during the last epidemic in the Americas in 1991, which broke out in Peru, there were about 500 cases reported over a 2-year period in a country at that time that has about twice the population that Haiti currently has. The case fatality rate of those cases reported in Peru was less than 1%. So as I have said, we expect the numbers to arise, but the emphasis is placed on prevention, ensuring clean water and sanitation, promoting good personal hygiene, food handling practices, including hand washing, and also trying to prevent defecation in open areas which may lead to water source contamination. However, if a person becomes infected, it is critical to ensure then effective treatment is available on a timely basis to minimize the number of deaths. Another important thing in cholera is the proper disposal of bodies. Body fluids from cadavers can be a source of infection, so bodies need to be disposed safely. And to that end, PAHO is mobilizing experts to travel to Haiti to provide technical cooperation for the proper disposal of bodies. What else is PAHO doing? PAHO continues to mobilize international experts to Haiti and also to the Dominican Republic in epidemiology, emergency management, water and sanitation, logistics, risk communication, and case management. PAHO's ProMess, its warehouse located near the airport, is well stocked with oral rehydration salts, IV fluids, and antibiotics. And currently, PAHO, with the Ministry of Health and other partners, is conducting a needs assessment to make sure we continue to have sufficient supplies as the numbers increase and cases continue to occur. We are supporting the water and sanitation cluster in Haiti, providing powdered chlorine, including supplies donated by the government of Brazil, for water purification and testing water that is being distributed to the settlement camps. Efforts are being directed to ensure clean water in all hospital facilities as well as health centers. PAHO's Caribbean Epidemiology Center, located in Trinidad, is helping the Caribbean ministers of health to mobilize and be prepared for any potential cases of cholera that may spread to their countries. PAHO continues to coordinate these efforts with all the UN agencies and with health officials in the United States and Canada. You will find updated information on PAHO's website at www.paho.org. I think I'll stop there and answer any questions that you may have.
Thank you, Silvia Yuso from the German Press Agency. You said that there are some more cases spread around the country, not just in the initial part. Are these also related, like the first imported creams that were infected in the first area and have been spread, or are they new I don't know what to say, new cases, meaning that the disease is spreading all around?
In the absence of data that is collected to determine the molecular epidemiology or the genetic sequencing of the bacterium, in the absence of that information, I can't give you a definite answer, but the voice of reason, all logic, suggests that this is spread of the outbreak. We know that the virus or the bacterium is going to spread very rapidly. We will see, based on our experience in 1991, rapid upswing on the epidemic curve in terms of the number of cases reported in these early weeks and months. I mentioned the possibility that an importation could happen, but it's given the wealth of evidence that we have on the extent of this outbreak, it's continuing to spread, and it's unlikely that we'll see a new infection that was imported from another country. I hope that answers your question.
Maria Magello from the Voice of America. Reports talk about the fact that this outburst might affect more people in the slums of Port-au-Prince than the ones that are displaced and that are in the camps. Could you talk about that, and why is that, and and what is being done right now?
It's an excellent question, and it really highlights the need to, based on each local community, identify the critical risk factors for the introduction of infection and the potential for its spread. In the resettlement camps, where water and other sanitary services have been provided, one might speculate that they have better protection, as opposed to what you suggest in a slum area where water services are still less than desirable, perhaps. So you raise a great point to ensure that every neighborhood is evaluated and addressed, and what needs to be determined, what needs to be done at that particular local level. And we can't miss that, because if we were to overlook the slums and only focus on the resettlement areas, we could have missed the opportunity to prevent a significant number of infections as well as deaths.
Yo vengo de la misión española en Talavera. Queríamos preguntar a ver si puede facilitar cifras sobre el esfuerzo financiero económico que está suponiendo en concreto para la OPS, todas las medidas que está tomando la comunidad internacional para contener el brote en Haití.
It's a great question. I think if I understand right, she's asking whether we need additional resources, and the answer is definitely, and we're talking to our partners that include several countries within the region. I mentioned Brazil, but others, for example, Cuba and other Caribbean countries, Argentina, up and down the Western Hemisphere, and then outside the hemisphere, Spain, and also our partners to the north, the United States and Canada. So we're reaching out for support to prevent and control further spread of this outbreak.
As we talk about the outburst in Haiti, there's also the same thing that's happening in Nigeria. And I was wondering, for a country like Nigeria that has been dealing with something like that for a long time, has there been any consultation as to how they can help? What kind of ideas you can exchange with them
Excellent question. Excellent question. And the question was whether or not we're reaching out to countries such as Nigeria that has the experience of having outbreaks over the years. Recall that this current outbreak that we're having in Haiti is the first of its kind in Haiti for perhaps more than a century. There's been no recent documentation of cholera transmission in Haiti. So with that in mind, we're doing several things, and I'll highlight the key activities. Within our region, based on the 1991 epidemic that we had that virtually spread throughout the hemisphere from Argentina to Canada, we have very strong expertise that was actively engaged in that control of that outbreak that actually continued to sporadically produce cases over several years. So we within the region have substantial expertise that we're mobilizing very quickly, that teams that have arrived over the weekend to Haiti and today and tomorrow. But in addition, as you mentioned, we have a very good relationship with the WHO Office of Africa. Dr. Sambo has made several visits here, and we've visited their team over the years to share ideas and exchange information in the area, in several areas across the board with public health, including immunization, for example, and the eradication of polio. We've mobilized experts to go to Angola. We've had experts go to Nigeria. And we think it would be very useful to receive experts there as well. I think that's very much open for discussion, and I think we'll follow up on that. In addition, in Bangladesh, another country that has had almost on a yearly basis experience with overwhelming outbreaks of diarrhea and cholera, so we are in communication with experts from there as well.
We have a question from the BMJ, the British Medical Journal, who asks you to explain how, despite the appalling conditions that people are living in the capital, there had not been a cholera outbreak before now, and what are the chances of this happening again?
That's $1 million question. It's something that I think people have thought about, particularly in reference to the 1991 outbreak that I mentioned. It happens that Hispaniola had no reported cases of cholera, whereas we received reports of cases in New York City and Montreal and up and down the corridor of countries of the Western Hemisphere. But interestingly, it never reached Hispaniola, which is the island that has both Haiti and Dominican Republic. And as I understand it, did not reach other countries in the Caribbean as well. So I don't know that we have a good answer to that. There's always the issue of island epidemiology, where you have a small geographic area. Perhaps the factors that would contribute to transmission establishing itself and taking off might be different than a situation such as the populated coastline of Peru, for example. But there are many hypotheses that have been generated that I won't go into. But I will end by saying on the last part of that question, now that cholera has established itself with a strong foothold in Haiti, it's probably clear to us that this will not go away for several years. We'll need to, this full surge of cases will come down, but there will probably be sporadic cases in the future now that the bacteria is well established in the environment. And so we need to plan that way, and we can't predict, we don't know, but on the other hand, we need to be safe and sort of plan and mobilize resources and develop the capacity that in the long run will help the Haitian people.
Okay, thanks. We have a question from Richard Knox on the science desk of National Public Radio, who says, do we know if there is a possibility of person-to-person transmission, both within Haiti and from Haiti to other countries in the region? PAHO has said that person-to-person transmission is rare, but could you clarify our current thinking about the risk of person-to-person spread in Haiti's conditions, and would it require a critical mass of cholera-infected people in Port-au-Prince to touch off an epidemic there?
Well, I'll answer that question to the best of my ability. That when you look at the epidemiology of cholera transmission, certainly the greatest contribution to transmission is the contamination of water, the contamination of food, and the source of that contamination happens to come from human beings. The measures of prevention are so simple. Hand washing, sanitation, that person-to-person transmission is less likely to contribute. It's less infectious in that sense. So all I can say is that the overwhelming contribution to this outbreak and the transmission that we're seeing is due to water and food contamination, perhaps most significantly water. Now, that's not to say if you have intimate relations with somebody or in an intimate contact and you are shedding the bacterium in your stool, certainly that is going to be a potential source of transmission. But on the great scale of things, it doesn't emerge as strong a predictor of transmission. And that's not our experience. What I mentioned in the briefing is the concern that the bacteria in a dead body, a cadaver, still remains, and if they're not handled appropriately, then that could be a source of transmission. And we know in Haiti there are certain cultural practices where, as in other cultures, the body may remain in the household. There may be increased risk of exposure that we really have to mitigate and address with this particular outbreak.
Okay, and then we have one more question from Maria Peña at EFE News Service. And I don't know if it's a premature question or not, but she says, what signs are we looking for to declare that the epidemic is over or winding down?
Well, I think perhaps some of the first signs will be the reporting from the sentinel sites that we have established in the early warning system that came about as a result of efforts to respond to the earthquake. Hospitals will have fewer beds, fewer cases that they'll need to treat. Will that mean, though, that as we start seeing fewer and fewer cases, that it perhaps could not come back? I don't know. I wouldn't say, and I wouldn't attempt to predict it. But I think it's safe to say that there'll be, after this initial phase and we're successful in controlling spread, that there will be lower levels of transmission in cases that the system needs to be prepared for.
Okay, we have one more from Cynthia Rush of EIR News Service, who says, given the 1.5 million people living in camps in the capital, how are you going to provide the quantities of clean water and other supplies to this large number of people living in subhuman conditions? And has any thought been given to relocating these people to other places outside the capital?
That's a tremendous challenge that I believe the partners have done. Put in great efforts through the water and sanitation cluster. It's a separate cluster focused on providing safe water and sanitation services, particularly to these displaced populations. That includes a number of UN agencies and other partners such as PAHO and other partners. So they will continue to work and provide these services. Efforts are in place to try to distribute resettlement areas in other areas, not to make them so concentrated in the Port-au-Prince area, and those efforts are in progress. I know that at the PAHO office, in fact, on our compound, we had a group living there, and we were able to locate other land so that we could, our office was not destroyed, but it was significantly damaged, and as we repair and repair that damage, we needed that area in order to bring in the necessary equipment and supplies to refurbish our office. So that was a challenge that was successfully met, and so I leave you with that there are efforts, and we're hoping that these people can be in situations where they're not intense for much longer.
We have another question from Jody Leonard, who says she wasn't sure if she heard you say there had only been 500 cases in Peru in the first year of its epidemic, or 500,000. I
should have said 500,000. I hope that's what I said. If I did not, it should be 500,000.
Another question from the Dominican Republic, who says, what is the actual situation with respect to risk to the Dominican Republic at this moment of cholera crossing the border into the Dominican Republic?
There's a very high risk. That's the short answer. I think we need to be thinking that the infection is going to reach the other side of the island. I think that's the answer. And we have the experience of the 1991 pandemic, where, as I mentioned before, virtually every country, with the exception of the Caribbean countries, had cases. So being on the same island, knowing what that border is like, and having visited that border myself, it's very porous. There are some checkpoints, but people go across that border. I've heard somebody say today, one of our epidemiologists in the office here, Dr. Espinal, who is from the Dominican Republic, an epidemiologist, and he said he called it a virtual border. So people are going back and forth, and in fact alerts us as public health practitioners that regardless of the infectious disease we're trying to control, it should be an island-wide approach, whether it's malaria, whether it's cholera, whether it's filariasis. That's the nature of the epidemiology of these diseases on the island.
Okay, then I think we have time for one last question, which also comes from the Sophie Ari at the BMJ, who says, will PAHO be doing anything differently from now on in preparation for further outbreaks? And compared to other countries, how would you describe the vulnerability of the Haitian population to epidemics right now? And what more should the international community be doing about it?
I'll start with the last part of that question. I think it's all about capacity development. It's a development model where we respond in the short term to outbreaks or catastrophes as we have been confronted with most recently. But the vision and the strategy should be grounded in a long-term plan of support to the Haitian government to develop the capacity that would lead to a sustained surveillance system with a network of human resources and Haitian public health experts managing this system, supported with by partners such as PAHO and others. But that's the long-term goal. We can't lose sight of that. We're right now up to our ears responding to this immediate situation, knowing that as the clock ticks, perhaps another person is dying. And in public health, that's what we want to do, is put a face to the data, respond immediately, but don't lose sight of the long-term vision and sustainability and capacity development issues. And thanks everyone once again for coming to this briefing. Appreciate it.